Hi, I'm Shane. I'm a physiotherapist by profession, and I've worked for 15 years in tech for social good, building things like telemedicine, e-learning, M-Pesa in Afghanistan from 2003 through till 2015. All of this is on the internet. My mother fell in 2016, and that brought me back to the healthcare sector, which is very fragmented and siloed for dignified aging and caregiving. And that was the inspiration for Thriving.ai. We know that our world is aging and it's aging fast. People are living longer, but not necessarily healthier. And the burden of care is falling on family and governments, which cannot afford the present model of care, which is fee for service or institutionalization or hospitalization. And there are better technologies out today and better ways of serving our seniors. Thriving is on a mission to bring cost-effective care and support so that people can age where they want to in their homes. There are over 703 million 65-year-olds and above. This will rise to 1.5 billion by 2030. And globally, this number will increase to 2.1 billion. There is scarce data. The services are fragmented and siloed. Loneliness and isolation and lack of connection is a major issue as families and children of older adults move and work in different parts of the world and cities. And therefore, we need a solution that can scale, that can traverse distance, and can work in different geographies. So what is Thriving AI? It's a digital app that basically brings everyone together that's involved in healthcare and social care to support individuals in the community. We have Molly, who's an aging older adult. She requires more support to live independently, but wants to live independently. And she doesn't want to feel a burden on her family and friends. Her daughter, Jessica, in the bottom left, she is juggling family, kids, career, financials, and the stress on her is incredible. 1 in 3 Ashleys leave the workforce, which costs the government in tax revenue and employers in revenue. Sophia, the health worker here, she has to deal with a shortage of caregivers, a high level of burnout, and lots of administrative work. And organizations that provide home health care or services to older adults, they don't have real-time access to data on which to make decisions. So Thriving AI basically provides enhanced connectivity amongst all these individual parties. It helps them exchange information in near real time and helps them manage people in a more effective way and reduce the stress on their caregivers and employees. Our initial pilots showed that older adults aged between 78 and 94 years could use the technology and felt very connected, contrary to stereotypical views that older adults cannot use technology. 50% of the family that engaged said that they had greater peace of mind and confidence in allowing their parents to live independently. And care workers and professionals involved in care saved 20 to 30 minutes in administrative and care coordination tasks, which in the UK, where the pilot was done, saved between £1,200 to £2,000 a year per caregiver per patient, which adds up to a lot of money. We're still working with care providers to identify how the data that we collect can help them. This is the calculation of the cost saving. Why is Thriving AI different and innovative? There are lots of solutions out there, but they deal with one problem at a time. And older adults and their caregivers said that they needed an integral solution that brought what and who they needed in one place. So Thriving is providing a unified platform. It's integrating care coordination, monitoring, and communication to save time and to improve the care experience. It integrates remote monitoring and is simple to use. It's interoperable and can be connected through APIs to the electronic medical record system. It's encrypted, HIPAA compliant, GDPR compliant, and is protected and managed with data services from AWS on the cloud, region specific as required by health regulation. We've done several pilots, lots of testing and interviews, and we've raised some investment as well. Our team is multicultural, multi-ethnic, geographically representative, and all of us are driven by profit and purpose, and we all have caregiving in our backgrounds. Our aim is to move the cost curve from acute care and institutional care, which is not desirable and is expensive, towards community care, where the quality of life is better. It's what 90% of older people want, and the cost of care is a lot cheaper. It's scalable, and it moves towards a preventative model. The Sustainable Development Goals are very important to our team. We focused on them from the get-go, and they remain a core part of our delivery. Just to describe a few things, this is our application. I won't go into it in detail, but it has mood reporting. It has the ability to do video conferencing, texting, and talking. It has various resources in it. It brings the care circle together. And if you choose to integrate a smartwatch or IoT, that can be integrated. But we also use camera technology to capture your vitals, including diabetes, cardiovascular, respiratory, pulse, etc., which is a low-cost method instead of sending patients out to buy lots of gadgets that they have to charge and then dispose of. We collect the data on the back end, which is anonymized, and it can be cut in various different ways to provide insights. We're working on an algorithm, and we're already translating the data to provide a health and wellness score, and we aim to make this an additional piece of the overall wellness that health and care professionals look at when they're looking at an older adult. We have a virtual assistant companion coming later this year, and our benefits are to the thriver, the older person or the care recipient, to family, to caregivers, and to organizations that interact in the care continuum. What we're trying to do is bring ownership of your health and power and dignity to older adults so that they can confidently live independently with their families, having peace of mind and not being a burden. Our potential targets are families living at distance, expatriates, home healthcare companies, independent living communities, hospitals for early discharge, and managed pre- and post-operative care so that the time spent in hospital is less and the cost is reduced. Community nurses and geriatric centers are also very interested in our services. We've raised money, we've got pilots, and we're excited to bend the cost curve here. We're excited to participate on the MIT Solve Challenge, and we hope to be able to speak to you in person soon. Thank you. I'm Shane, the founder, Thriving.ai.